Professor Cheng, thank you very much for coming. You are the superintendent of the Changung Memorial Hospital in Kaohsiung in Taiwan. But most of all, at least for me and for the people who are there, you are the director of a world-known liver transplant program who is focusing mainly on living donation. So my question to you would be, how do you explain that in your area, in Southeast Asia, that living donation has become to such an expert level that we cannot reach in the Western world? Because you know very well that a lot of hesitation is in the Western world about living donation. So what are your thoughts about it? How do you explain this huge discrepancy in viewing living donation in case of liver transplantation?
Well, thank you, Professor Lerut. The great success of liver transplantation in the past 30 years has brought about increase in demand for the liver graft. And Westerners and Easterners cope differently with the problem of organ shortage. Well, the Westerners campaign to promote the deceased donor organ donation. The Easterners, they have to sharpen their skills and focus on living donor liver transplantation, as it is more acceptable in most of the Asian culture. Traditionally, many religious groups and traditional concepts do not encourage deceased donor liver transplantation. So that's really a kind of demand. But we have no choice to sharpen our skills to develop the living donor liver transplantation. While the pioneering work of liver transplantation began with Professor Stado in the US, Asia seems to be in a better position to lead the way forward in living donor liver transplantation. All 5 of the global leading centers for LDLT seems to have Confucian heritage, mainly Japan, Taiwan, Korea, and Hong Kong. Living donor liver transplantation has flourished in the past 20 years, especially in Asia. And Asia seems to be in a better position to lead the way forward in the technical innovation in living donor liver transplantation.
And do you think the explanation of the success is also due to the fact that all the team is behind
Yes.
the program? Because in the Western world, the problem is that usually living donation is reduced a little bit to a surgical, I would say, experiment is not the real word, but it's mainly going to a surgical domain, and I think all the other fields linked to liver transplantation are not involved enough. How do you do this to have all your team members behind such an important project? Because there is always a problem of the risk of the donor, the complications in the donor. How did you convince? Is this also due maybe to religion, to the background of religious living of the people, or is this independent of this? What do you think?
I think organization is very important. You really need a very devoted team who are willing to strive for perfection, because living donor surgery is quite different from other surgeries. Because in living donor liver transplant, donor safety is always of paramount importance, because in the history of human surgery, only patients with disease undergo surgery. Is also a major surgery,
It's
and
right.
not for himself, it's for somebody else, for beloved family members. So you cannot go anything wrong with the donor. We cannot make the donor to become a patient. So you really need to strive for perfection. And also we need to have all kind of effort to protect the donor. Even in my series, we are doing 3 living donor liver transplant per week. But if there's any donor is through the workup is perfect, anatomically, physically fit, but if it's psychologically not comfortable to donate, we always find a medical reason to refuse the donor. And in this situation, if the donor usually with the family bond in Asian country, they can hardly say no. But we as a physician, as a surgeon, we find the medical excuse for them to reject to be donors.
So what would you advise to the Western world in order to advance in this field? What is your advice with all your huge experience in this field? What do you say to the Western transplant teams how to develop living donation? Because anyway, everywhere in the world there is shortage of organs, so we should not skip, of course, post-mortem or disease donation, but what should you advise based on your huge experience in this field to Western world in relation to living donation in the field of liver transplantation?
But I think we in Asia, we have the advantage of having quite a lot of the large experience in liver resection, because liver cancer, as you know, that in Asia, where hepatitis B infection used to be very prevalent, and we have a huge experience in meticulous surgery and to deal with liver resection for all kind of liver cancer and liver disease. With this experience, I said it's very important also for the donor safety. But I'm sure in the Western, in Europe, the experience in liver resection is in some centers also very, very experienced. So I think through the organization of a devoted team, I think there's no reason that in Europe you cannot have similar success as we have in Asia.
Okay, thank you very much for this interesting interview. Thank you. I hope you enjoyed the participation of Asian people in this European Congress. I'm sure you have appreciated this. Thank you very much.
Very much. Thank you.